Now we start scanning from epigastrium by using convex probe, placing at transverse position. Here we see the left lobe of liver, which is normal. No mass lesion seen. Below the liver we see the duodenum. The duodenum is prominent and contain food particle, fluid and air. But we see no peristalsis in the duodenum. Now we slowly sliding probe at right side to examine the texture of liver. The liver shows normal texture, no mass or lesion seen. This is right lobe of liver. Here we see the gallbladder. Now if we focus gallbladder, we see another cyst at the fundus of gallbladder. Now we continue scanning from epigastrium to the right hypochondrium between the ribs. Here at mid-clavicular area, we see the gallbladder, which is partially contracted. And this is junctional fold, which present at the neck of gallbladder. The walls of gallbladder are echogenic and appears to be thickened. Here we see the cyst at the fundus of gallbladder, which is abnormal finding. So we will examine this cyst. As the patient is dyspneic due to pain, so it is difficult to locate this cyst, and patient is also feeling pain at this area. Now we examine that whether it is diverticulum or outpouching of the gallbladder or leakage of gallbladder at this area. So we will examine the wall of fundus. Here also we see the fluid around the wall of gallbladder. The cyst at the fundus of gallbladder is also a collection at pericholecystic area. Now, if Here we focus at the fundus of gallbladder. We see a defect in the wall of fundus and the bile is leaking from this defect in the surrounding area. Here we measure the size of this defect. The size of defect is 3.2 millimeter. Now we will measure the size of gallbladder wall. The size of gallbladder wall is 3.7 millimeter, which shows inflammation. The normal size of gallbladder wall is up to 3 millimeter. Now here if we focus that the intrahepatic biliary channels are prominent but not dilated. Now we will scan the common bile duct. This is portal vein and this is common bile duct, which is also prominent and appears to be dilated. So we will measure the common bile duct. The common bile duct size is 8.3 millimeter. It shows that the common bile duct is also dilated. The normal size of common bile duct is up to 6 millimeter. Here also we will measure the size of portal vein. The size of portal vein is 7.8 millimeter, which is normal. Now we will continue scan to the common bile duct to rule out cause of obstruction, whether it is due to mass or due to some calculus. Here we see the pancreas. Here we see the pancreatic duct in the body, which appears to be normal, and the pancreas is also normal and shows homogeneous texture. But here at unsnake process, we see a cyst. Pancreas is poorly visualized due to gases. We see that the pancreatic duct of unsnake process is dilated. So there is obstruction below the unsnake process of common bile duct. But we can't see any cause of obstruction at this area in the common bile duct. Now, how we will write report?